Welcome to week 2, me presenting again on another disease. I'm going to be covering alcoholism. It's one of probably the biggest diseases a lot of Americans are dealing with. And alcoholism is the one disease that most people will probably never recover from, or they will never choose to stop drinking alcohol altogether. And the whole point of this is to educate the public. I started my YouTube channel 5 years ago when I was in school studying nutrition, and the school wanted us to educate the public and post YouTube videos, and this is what we're going to continue doing and use our nutrition degree to educate the public. And this is my third presentation on disease. The first one was tuberculosis, the second one was lupus, and the third one is alcoholism. And I think it's important to educate the public because alcohol is the one beverage someone will consume and it will have no nutritional value. It's the most harmful thing they can consume, and those people will not understand. They will not understand they never need alcohol. They do not understand it's not something they needed to have fun. It's the most harmful thing they did to themselves. And some of them will never just stop drinking alcohol. They will just do dry January and then think it's fine. And so that's why I'm going to educate, because alcoholism actually isn't fine, and it's not fine if you're dealing with someone that has alcoholism, because sometimes they just don't understand. They did that to themselves, and they're drinking alcohol to the point where they're getting drunk or they're harming themselves, and they don't understand. So they're doing it to themselves. So it's pretty much just to educate the public. In alcoholism, the definition is a chronic disease in which a person craves drinks that contain alcohol and is unable to control his or her drinking. A person with this disease also needs to drink greater amounts to get the same effect and has withdrawal symptoms after stopping alcohol use. So they have withdrawal, meaning they're going to have a hangover. These people, this woman is not going to be drinking one alcohol drink per day, and that man's not going to be having 2 alcohol drinks per day like the recommended daily allowance. They're going to be having 5, 6. They're going to be drinking to the point where they're getting drunk. They're going to be giving themselves depression because alcohol is a depressant. So what they're doing to themselves is actually sad, and it's sad that they're harming themselves. And they're pretty much at that point they're an alcoholic. Not all of them will be considered alcoholics, because not all of them will be getting drunk on a daily basis. Some of them might be getting drunk once a week. And then the definition for alcohol use disorder is a common medical condition in which this disorder, people can't stop drinking even when drinking affects their health. So alcohol is a depressant, so they might get depressed. Alcohol, it damages your liver, your stomach, so they might have liver damage, stomach damage, and they're not going to stop drinking. And they might be the most deficient population, and then they might have weak bones because alcohol causes weak bones, and they might be missing calcium, vitamin D, because the alcohol use they're dealing with every day is making them malnourished in certain things that they need, and they will not stop drinking alcohol. So when they're drinking, it affects their health. Plus, their safety is at risk and damages their personal relationships. Treatment includes medication and behavioral therapy. Studies show most people can reduce how much they drink or stop drinking entirely. So some people will do dry January, and then some people will just drink from February to December. So for some people, it's not an alcohol disorder. They just choose to get drunk when they should have never got drunk to begin with. And then from the nutrition perspective, from a dietitian or a nutritionist or doctor, the daily allowance is 1 drink for women and 2 for men. And then what's considered too much, the American Medical Association recommends a 2-drink limit for men. Heavy drinking in the population is 5 or more drinks in one day, or 15 or more drinks a week. Women should limit drinking to 1 drink a day. Heavy drinking in this population is 4 or more drinks a day, or 8 drinks a week. So if a woman's supposed to drink 1 drink a day, and then drinking 4 drinks. they're already past they're already 3 drinks over their limit. And if they're drinking 8 drinks a week, that's not considered normal. Should be drinking 1 drink a day, 7 drinks max a week. And then some health concerns for alcoholics is a lot of them can get cancer because the way alcohol is made, when it's going through the fermentation process, lactic acid is produced. That acid can literally cause cancer if they overdrink alcohol and the lactic acid in their blood gets too high, they can have a seizure or they can have a silent death. So alcohol does all of that to them that's how it negatively impacts them. It gives them cancer. It gives them cavities because the acid from the alcohol it has a negative effect on their teeth. Same thing as sugar. If you don't brush your teeth, brush the sugar off, it's going to become acidic, you're going to get cavities. Alcohol is always going to give you cavities. Anything acidic, you're going to get cancer. And then depression, because alcohol is a depressant. It's going to cause a chemical imbalance in your brain. Your neurotransmitters are going to be off. Your serotonin level, what's responsible for making you happy, is going to get low, and all the bad chemicals, it's going to disrupt your whole brain, your neurons. And then that's what's happening. You're drinking a depressant and you're giving yourself depression. That's what happens when you drink alcohol. And if you're drinking to get drunk, drinking more than 1 drink a day, or drinking 4 drinks a day, you gave yourself depression from drinking alcohol. And then obesity. Studies show that alcohol intake can be a risk factor for obesity because it has all that calories, and a lot of those drinks are mixed with sodas and other syrups. So they're saying if you're going to be drinking, if you're going to go out to a restaurant or you're drinking at home and you're having that 1 drink, you have to count that into your overall calorie intake. So if you're on a strict 2,000 calorie diet or 1,500 calorie diet because you're losing weight, you need to include that the alcoholic drink is part of your calories. That does not exclude it. That if you're going to be drinking 3-4 drinks and you're trying to stay fit, you're going to get fat if you're drinking all the sugar drinks. And alcohol has extra calories. That's why you're gaining weight, also on alcohol. And it's also causing probably damage to your stomach. All that sugar is increasing your blood sugar, probably causing damage to your stomach lining, your liver. You might get fatty liver disease too from alcohol, because alcohol is the one thing you're going to consume that has no nutritional value to you. You're just taking away from yourself and your nutrients out of your body when you're consuming alcohol. The dumbest thing you could do is drink one or 2 drinks, or more than the daily allowance for yourself, because you're drinking alcohol and you're literally making yourself unhealthy from drinking alcohol. And then memory losses and dementia is also very common. And in a French study, when they were looking at people with dementia, a majority of them were drinkers. It says 1 million adults found that 57,000 cases of early onset dementia, 60% of those people were drinkers. Again, back to the depressant part, alcohol has no nutritional value to your diet. It's a depressant. It's going to change your chemical imbalances in your brain, mess up with your cognition. Makes sense. You're going to get dementia. 60% of those people got dementia because they effed up their chemical imbalances in the brain. Another thing, fatty liver. It's the liver's job to metabolize nutrients from the things we eat and drink. Having too much booze at once overloads the liver, causing fat buildup. The excess fat is stored in the cells, liver cells, and that gives you fatty liver disease. All the extra fat can also risk for harmful inflammatory diseases such as alcoholic hepatitis. So you could get 2 types of hepatitis, one from contaminated foods and one from contaminated body fluids. If you drink too much alcohol, you're going to get hepatitis, and alcohol is going to count as the contaminated food that gives you hepatitis. Fun fact for you. Stroke. Binge drinkers are 4 times have 4 times more likely to have a stroke, and it's mostly because when they're drinking alcohol, it affects their blood vessels. They get bigger or smaller, tightens them, and they're at a greater risk for a stroke. And over time, also, heavy drinkers can have their heart muscles could become weak and saggy. It causes heart disease because alcohol is the lactic acid in alcohol. Pretty much that acid does damage to your body. And then the higher the alcohol content, the more acid in the alcohol. Literally, your body is not meant to handle acid, and that's what's happening. That's what's in alcohol. So pretty much those people, if they're alcoholics or they're heavy drinkers, they're giving themselves cavities. They're putting themselves at risk for hepatitis, cancer, all those diseases because they're drinking an acidic substance. That's what alcohol is. It's just acidic. They get hangover. Their brain has chemical imbalances, and then some of them will throw up. Experience that hangover. And then if you're gonna go the non-alcoholic route like I am, I'm never gonna drink. If I ever drink, it's one drink, food always, never gonna go with that food. And most of the time I don't need alcohol because alcohol is an acidic thing. I don't need acid in my body. So 95% of the time I'm always gonna say no to alcohol. And if you do want a fancy drink that does not include alcohol, you could get a mocktail. They make soda water with mint and lime. You could have a virgin mojito. 100% of the time, mocktails always taste good. You don't need the acid in your drink, the acidic alcohol. It's gonna mess up your alkaline body and mess everything up. So just have freaking a mocktail. If you don't have to do dry January, you can remain dry for the rest of the year. And then also a well-balanced diet. Eating well is going to keep you healthy. Food is what's going to affect every system in your body. If you're eating the right foods, you're going to have healthy blood circulatory system, healthy heart. You're going to have a good weight. You're most likely not going to be obese. You're going to have good bones. If you're eating the right foods, you're going to be healthy. And then for recovering alcoholics that choose to go completely drinking alcohol, the acidic substance, we all know alcohol is acidic and only does damage, the depressant substance, if they're not going to go to rehab or just in general, if for the recovering alcoholics, carbohydrates are the most important. Your brain needs carbs to make the chemical messenger serotonin. Serotonin is what makes you happy. So when you're eating breads, carbs, pastas, your brain's reacting. Those foods are good. They tend to be the most tasty. Your brain's gonna send those signals. Serotonin is the happy neurotransmitter. That's what your brain's gonna feel when you're eating carbs. That's what evens out your moods, helps you sleep better, and soothes the urge for alcohol. Studies suggest a diet with lots of complex carbs, whole grains, veggies, peas, and beans. That's if you're completely quitting drinking alcohol. Amino acid. Your brain needs amino acids to make dopamine. Without it, you can have strong cravings, mood swings, and hostile behavior. We get amino acids from protein in foods like meat, dairy products, and nuts, along with some grains and beans. Dietary fat. It eases inflammation and protects the thin layer that surrounds your brain cells, called the cell membrane. This gives neuroplasticity a boost. Canola, olives, sunflower, sesame oils are all good sources of healthy fats. Fatty acids. Omega-3 fatty acids found in shellfish and fatty fish like salmon also ease inflammation. While omega-3 fatty acids help with neurotransmitter activity, you can find it in corn oil, sunflower oil as well. And all of that, when you're recovering from alcohol, the main emphasis is foods that prevent inflammation and foods that are good for your brain, because alcohol is the depressant. It's the acidic substance that affected your brain first. So most people, they may not experience any health concerns, but if they drank to the point where they're getting drunk and they're having hangovers, it affected their brain first. And some of them will have their mental health will be like a dumpster or in the dumpster because they drank a depression, they gave themselves depression, and they effed up the neurotransmitters. So a nutritionist, dietitian, doctor are always going to give you foods that's going to help your brain and then help inflammation, because they're trying to get, once you quit drinking alcohol altogether, if that's what you're going to finally decide, you're going to quit that acidic shit called alcohol. You're never going to put that poison in your body ever again, because once you get, that's the one thing that's never benefiting you. It's never going to make you healthy. Yeah, you might have fun going out with your girlfriends and having alcohol, but in the end, if you're going to have dumpster mental health, you gave yourself depression because you drank a depressant. If you don't want to have dumpster mental health, quit that alcohol consumption. Eat healthy foods. Eat foods that make your brain happy, make your body happy. If you need to find out if you're deficient, what's going on in your brain, you might have to go see a doctor. That's what's happening. They're drinking a depressant. They're getting depressed. Most of them need to stop drinking alcohol. That's what happened. They got crappy mental health. They put an acidic substance in their body, and they need to get healthy. They need to recover, and most of them need to get their blood work done and see what's happening if they're deficient in something. And then alcohol also has a negative impact on bones. So some of them could be having like deficient in vitamin D and calcium. So most of them, if they're gonna quit, when they finally decide to quit drinking alcohol because they figured out they were dumbasses for drinking alcohol and getting hungover, when they finally become that smart and that healthy, they're gonna finally have to go to the doctor and get their blood work done and see what they're deficient in, and then they're gonna have to finally get on that diet and hey, you were depressed because you drank alcohol. You put all the acid in your body. You gave yourself shitty mental health. You gave yourself fatty liver disease. That's why you look fat. That's why you have so much inflammation, because you only drink acid. And you thought drinking 4 acidic drinks going out with your girlfriends was cool. It's not going to be cool when people see that you're effing depressed and you might have a brain disease. And then when you're like 70, you're going to get dementia, because that's what it's cognitively affects you first before it affects every other thing. And if you're getting cavities and you're drinking alcohol, stop drinking alcohol. It's an acidic substance. That's why you got cavities. If you feel like something else is going on, freaking go to your doctor, find out what you're deficient in, and stop eating shit. It's always your diet. That's why you get sick. That's why, and honestly, people don't need alcohol to have fun. It's literally acid that you're drinking, and you think it's tight. It's not tight when you end up having dementia at 70 or 80 years old. And everyone's like, they got dementia because they were alcoholics. They chose to drink and get drunk. They didn't choose to avoid an acidic substance called alcohol that gave them brain damage. They did that to themselves, and they thought we did not know more than we knew more than them. So quit drinking alcohol if your mental health is getting crappy, and get healthy, eat the right foods, and recover, and love yourself, and get that it was always diet. What you eat is what you become. The more healthier you eat, the better you're going to be. And go to your doctors every 6 months to a year to figure out make sure you're healthy and make sure you're not deficient in anything, because your health is key. And we don't want us people getting dementia when they're 70 or 80, or getting horrible memory because they just drank too much, and they pretty much got cognitive decline because they drank to get drunk, because that's what alcohol does to you. So get smart, get healthy, use your resources. If you have health insurance, literally go to your doctor every 6 months, every year. Just get blood work done. Make sure you're not deficient. Get on the right supplements. Literally, that's what it's all about. It's about preventing cognitive impairment, preventing disease. That's literally what it's about. The healthier you are mentally, the better you're going to be overall. That's all it's about. It starts with your mental health, your physical health, your gut. If your gut and your mind are healthy, everything else is going to be healthy. So stay away from alcohol, stay away from things that are harmful to you, and try to be as healthy as possible, and do use your doctor for resources and your nutritionist, dietitian if you need help with nutrition. If you're deficient, reach out to those resources. That's what's gonna get you healthy and be preventative measures for certain diseases. Hope this is what you find informative, and it helps you long term. Thanks for watching.